Today I want to go over something we see all the time in our clinic, and that is discogenic low back pain. So basically what that is, if we have a vertebra above and below, we have a disc right in between, that disc can become inflamed and cause some discomfort in the low back. Essentially how that happens in most people, if we think of our disc as kind of like a jelly donut, we have a hard fibrous layer on the outside and a jelly material on the inside. That jelly material is supposed to stay confined within the disc. When it starts pushing out into those outer fibers, that's when we can have a little bit of low back pain. Essentially, if we have any weakening of the back part of the disc and we go to bend forward, this is what happens. That disc material actually starts to push out, and it can be bad enough to where it actually starts to impact the nerves that go down our leg. So that's when you get that sciatica, pins and needles down the leg, pain down the leg, that sort of stuff. And so that's what this is demonstrating. This is more of a disc herniation, but we can even have a little bit of a disc bulge. And essentially what that does, it's just enough to where it starts to impact those pain fibers that run around the outside of our disc and cause the muscles that are in the back to tighten up and pull us into extension. If those muscles tighten and pull us into extension, then naturally that disc material should go forward and back into the disc. However, that leads to a lot of muscle tightness in the back. And one of the first things we're tempted to do with muscle tightness is to go and try to stretch. So by stretching your low back, you basically go into this forward fold position, which we talked about, that actually makes that disc material go backwards. So it's kind of a downhill spiral. It's gonna feel good because you're stretching your low back, but at the same time, we're making that disc inflammation a little bit worse because we're pushing that material towards the back again. So what we usually wanna do for treatment for this is actually put ourselves into an extended position. Same concept, if we're bending forward and that material pushes back, if we extend backwards, we're actually pushing that material forward to where it needs to be. That's why with discogenic low back pain, typically if it is caused from the protrusion of the disc material backwards, that's when we want to do extension-based exercises. Okay, a few of those extension-based exercises are Mackenzie's, so standing extensions, bird dogs, anything where we are going into extension this way. So I'll make a separate video with some of those exercises, and then you can go ahead and try those out and see if that does help your low back pain. That is just one cause of low back pain. It is one that we see quite often, and it is something that can get better as long as you're doing the right movements. Every time we do bend forward and that disc material protrudes backwards, we're re-inflaming that disc, causing a little bit more discomfort there. So we want to avoid those forward flexion movements. Even if you're going down to like tie your shoes, you want to make sure that you're going down with a flat back and tying your shoes that way. Just something we see a lot, discogenic low back pain. Once again, that's caused from the disc material tending to push back, typically with forward flexed movements.